Ladies and gentlemen, dear Chairman, I would like to thank the organizing committee for inviting me to discuss about Alpelisib for patients with PIK3CA alpha-related lymphatic anomalies. Unfortunately, this is a remote presentation, but hopefully in the near future we'll have some in-person meeting. I will go very quickly on that because you are all aware about lymphatic anomalies, that they can be either isolated or generalized, they can be simple or complex, deep or superficial, etc. And in the vast majority of lymphatic malformation, the gene involved is PIK3CA alpha, and this is a consequence of a gain-of-function mutation in this gene. You know this pathway with PIK3CA alpha at the top of the cascade, leading to AKT/mTOR activation, and at the end, the growth and metabolism and proliferation of the cell. You know that Matthew Warman in 2012 identified some gain-of-function mutation in the PIK3CA alpha gene that explain usually overgrowth anomalies, and according to the tissue layers that are affected by this mutation and the time of occurrence during the pregnancy of this mutation, you may have different clinical presentation. I know that this gain-of-function mutation in the PIK3CA alpha are leading to difficult diagnosis with broad clinical presentation. And a few years ago, we created the mouse model of PIK3CA alpha-related overgrowth syndrome that recapitulates faithfully the patient phenotype and identified the BYL719, so now it's called Alpelisib. It's an approved drug in oncology, in breast cancer, and demonstrated its efficacy in our preclinical mouse model and in a few patients, in 19 patients, and now we are about to report the outcome of 57 patients in the PIK3CA clinical trial. But what is important to know is that in our first mouse model, we were using an ubiquitous Cre recombinase, meaning that this Cre recombinase was expressed in all cells, and playing with tamoxifen, we were able to modulate the degree of mosaicism and to modulate the degree of severity of the disease. But we were not able, with this approach, to understand the precise role of certain tissue. And we had a particular interest for the lymphatic tissue because when we were treating some patients with PROS, one of the tissues that was responding fairly well to the drug was lymphatic. So we decided to create, and this is a work that has been done by Florence de Lestrière, Charles Bayard, and Kitri-Veno. And all these three, they have created a new mouse model, which is a VEGFR3 Cre-ER, so meaning that you have a Cre recombinase that is expressed only in lymphatic endothelial cells, and we have confirmed that by doing plenty of experiments to confirm the absence of any leakage. And this is an inducible model, meaning that you can induce the disease whenever you want. So we were waiting up to 3 weeks of age. Then the mice are considered as adult, and then you can start the tamoxifen to induce the PIK3CA alpha overactivation in order to avoid any embryonic lethality. So we started to use different doses, so a full dose of tamoxifen, I would say, to have 100% recombination of PIK3CA alpha in lymphatic tissue. And what we observed is that while here you have the survival curve of the wild-type mice here, when you give a high dose of tamoxifen, 50 mg per kilo during 5 days, you see that very shortly after tamoxifen induction, the mice died, and they were dying suddenly with plenty of edema, plenty of lymphatic leakage. I'm going to show you that. So then we progressively played with different doses of tamoxifen in order to have a mouse model that could recapitulate probably the lesion presented by the patients and to have time to work on the physiopathology of the disease. And we identified that a low dose of tamoxifen was able to induce a low recombination rate in lymphatic tissue and to extend the survival of these mice and to allow us to work on these mice. Here is what we observe when we use 20 mg per kilo of tamoxifen. You can see this is the body weight of the male, here is the body weight of the wild type, and progressively our mutant mice progressively gain weight. This was the case for male, but also for female. As you can see here, they were infiltrated by edema and lymphatic malformation. And when we suck the mice, what we saw is that you had some ascites with lymphatic leakage, and also some pleuresia, as you can see here, and lymphatic malformation disseminated along the body. This was confirmed also with the use of MRI. You have an MRI of a wild-type mouse here, and here a mutated mouse, and you can see that when you remove the adipose tissue using some specific sequences, you can see that the mouse is developing plenty of cystic anomalies, large and microcystic, but also pleuresia, as you can see here, and ascites everywhere. We explored the histology, of course, of these mice, and here you have the skin of a normal mouse, and here the skin that we could, the lesion that we could find in the skin of mutated mice here, and these mice were faithfully recapitulating the macro and microcysts that you could observe in patients that were filling off with red blood cells, and here you have the kind of lesion that you could observe in different patients. So this mouse model mimic the lesion that we saw in our patients. And we confirmed that these anomalies were carrying some lymphatic markers such as podoplanine, but also you have some adipose tissue and alpha muscle cells that were dissociating the tissue, such as in our patients. We had also some lymphatic anomalies along the GI of our mice. As you can see, here is the normal GI, and here the lymphatic anomalies that we found in the different mice, mutant mice, and also the same things that we could observe in our patient. And this is, you have an endoscopic view of the malformation of one of our patients. We confirmed that the GFP, meaning that the crude recombinase was expressed specifically in lymphatic tissue and not leaking in other type of tissue. We explore also the permeability of the lymphatic vessels by injecting some blue events dye. As you can see here, in the wild type mouse, you don't have any leakage. You have the lymph nodes that you can nicely see here. And in the mouse model with the PIK3CA mutation, you have lymphatic leakage everywhere. And you can see that the lymph nodes are even not stained with the dye, meaning that the lymphatic vessels are abnormal and are leaking everywhere. We confirm, of course, that you had an activation of the PI3K AKT-mTOR pathway at the protein level using Western blot, but also using immunohistochemistry. You know that this pathway is leading to growth and proliferation, so we explored the growth and proliferation in our different tissue. We saw that in the lymphatic vessels, you had a high rate of proliferating cells in the mutant compared to wild type, and also using image stream analysis, which is a flow cytometry analysis, these lymphatic endothelial cells were bigger compared to the wild type cells. These mice were also developing some blood anomalies, and indeed we were able to find some low white blood cells counts with neutropenia and lymphopenia, such as we are seeing in patients. And we conclude that this mouse model recapitulates patient phenotype with different type of phenotype. If you use a high dose of tamoxifen, the mice will develop what we call the lymphatic generalized disease, and if you use a low dose of tamoxifen, you may expect to have more micro and macrocystic malformation, at least at the beginning. And these mice have some histological anomalies similar to what we are seeing in patients, such as the radiological features, so this should be a good candidate to use some drug testing. We tested indeed the Alpelisib, and what we did is that we started by a preventive study, meaning that we induced the disease in our mice, and then we immediately started Alpelisib in order to see if we were able to prevent disease development. And you can see that in the PIK3CA mutant treated with Alpelisib, all the mice were still viable at 125 days, while all the mice were dead in the group that received the vehicle. And also you can see the body weight change, so meaning that the mice treated with Alpelisib had a normal body weight compared to the mice that were treated with the vehicle. And at the histological level, the Alpelisib was able to prevent all the lesions. These mice had a normal phenotype. We then did another type of study with Alpelisib while the disease was already installed, and you can see that the first mice were starting to die. So we introduced Alpelisib in a subset of mice, and the other one was treated with the vehicle, and we observed that the Alpelisib was able to reduce the edema, reduce the lymphatic leakage, and improve the body weight, as you can see here. We did plenty of MRI, and here you have a vehicle-treated mouse, and here a mouse treated with Alpelisib, and we were able to rescue the phenotype of this mouse. And we also measured and quantified the evolution of the lymphatic anomalies here before treatment. So this is a mouse, PIK3CA alpha mouse, that received the vehicle. You can see that at the beginning of the disease, she has almost 100 centimeter cube for lymphatic malformation that increased, that doubled during a week, while the mouse that was treated with Alpelisib that was extremely severe at the same age, and then we treated and we had a huge improvement of the different malformation. We did some Western blot analysis to show that the Alpelisib was able to block the phospho-AKT and phospho-S6 therapy as expected, and also we checked the blood anomalies, and we saw that the Alpelisib was able to rescue, at least partially, the different white blood anomalies. So we found the Alpelisib was efficient in this mouse model, so we decided to treat 6 patients that had very severe lymphatic anomalies, either isolated or complex, and that were resistant to other treatment. As you can see here, 5 of them had received already rapamycin in addition to plenty of treatment, including sclerotherapy and surgeries, and 1 patient received already Alpelisib. And all these patients were not responding to other drugs, ranging from 2 years old to 39 years old. And just 2 examples, but you will see this patient very soon. And here you have a young patient of 2 years old with these huge lymphatic anomalies. And you can see that after 6 months, you had a shrinkage of the lymphatic malformation, as well as an improvement of her general condition, pain, lymphatic leakage, inflammatory flares. Another malformation of the tongue, as you can see here, that was infiltrating the base of the tongue, and after 6 months you can see a nice reduction of the volume of the malformation. Another view of another lymphatic malformation of the right part of the face that has reduced with the treatment over 6 months. And another patient here with lymphatic reduction, as you can see here. This patient had a complex vascular malformation, including lymphatic anomalies with lymphatic leakage permanently before drug introduction, and he received Alpelisib that was not efficient at all, and you can see that he was improved with the treatment. Indeed, we observed volume reduction of approximately 45% in all the patients during the first 6 months on treatment, and with a very limited adverse event, as you can see here. So this paper is in press in Science Translational Medicine. You should see that very soon. So as a conclusion, I would say that we created a mouse model of PIK3CA alpha related lymphatic anomalies. We demonstrated the efficacy of Alpelisib in this mouse model. We showed the efficacy of Alpelisib in patients with severe and resistant form of PIK3CA alpha related lymphatic anomalies. I would like to thank you for your attention. I would like to thank all the people that were involved in this study. They are here, people from my lab, and also all our funding support. Thank you very much.